My name is Sarah McCarthy and I'm a fourth year occupational therapy student studying here at Southern Cross University. I've just come off a 10-week clinical placement in a rehabilitation unit. I saw a wide range of patients with diagnosis of stroke, fractured neck of femur. This was my 5th clinical placement. It's been my most enjoyable placement by far. I think the fact that it was 10 weeks in duration allowed me to, you move past that introductory stage and you feel like you're being monitored to actually feeling like you're making a difference and being a clinician. You get to feel more comfortable in the environment. I was able to do a lot of individual therapy and I was also lucky enough to do a lot of group programs. So the facility that I was at ran a lot of group programs, at least 2 a day. I also saw individual patients, so I was constantly busy. And whilst it might have been in rehabilitation, I feel like a lot of the skills I learnt there were transferable to other settings. I feel like I learnt key skills of building quick rapport with patients and communication. I had to manage my own time, so I was given my own caseload, and it was important for me, especially in a rehab setting because these patients need to be seen daily. I had to liaise with a lot of different health professionals to put the welfare of the patient first. So this included stroke education meetings, it included family meetings, case conference meetings. So it was really important. I was constantly going, so communicating with the team or communicating with the patient. It's funny because my first clinical placement was actually in a rehab unit as well. And while this was an observational placement, it was only 1 week in duration. When I compare the two, it's quite astounding because in my first week, I didn't even know what OT was. I couldn't even explain it to anybody. I still had no idea. And I think placements are valuable because as you go through, you learn different skills and you gain a broader insight into what OT is and what it can do for people. And in my last placement, I got a full understanding, and by the end of it, I just came off feeling like I was ready. I'd finished with my, I guess you're always still learning, but I felt like it was time for me to learn in a different setting now. If I was to offer advice to students going on a clinical placement, I would say be ready to learn more than anything. Like, I know that sounds quite what everybody would say, but I think it's be open and ready to take on new information. Don't expect that you're going to, or don't expect to come out with a certain level of understanding or a certain knowledge. I would say just sort of ride the wave. I don't really know how else to explain it, but it's amazing what you think that you're going to learn on placement and then you come out on the other end and it's completely different. It's a different experience. And I think even if you're in a particular setting all the time, you might have had the same placement a couple of times, it's good to reflect that a lot of the skills that you learn are transferable to different settings. So other tips and hints for clinical placement would include making sure that you prep for placement. So I know that's difficult when you're not sure what to expect, but I would definitely read up on the area that you're going into, do a bit of background research so that you're ready when you get there. Other things might be remembering to ask questions. So I know that a lot of the time when you're in the moment or you might feel like you can't ask a question, but no question is a dumb question on placement. It's all about your learning. So I would always ask your supervisor questions and definitely reflect on your own practice as well. So I would seek supervision all the time, even if it's reflecting with your peers. So if you're on a placement with another student, just talking about your experiences with one another and then also with your clinical supervisor. And then if you have more than one supervisor, I would highly recommend to communicate with both of them, and the one that is your it's not so much about grading, but the one that is looking at your performance more, but communicate with them and tell them what you've done with the other supervisor so that they know how you're going and that you're reaching, your competencies. Take initiative. I know it's hard if you're more a reserved personality. I know in my second year I was quite reserved. I didn't really jump on opportunities, and I think it's important to branch out of that comfort zone. Don't go into placement thinking that you're just the student. I think that's a huge, it's sort of a huge mentality to get over, because you're not just a student. You in comparison to clinicians who have been working for 20, 30 years, yes, they have more clinical knowledge than you, but you have the most updated research from university, or you have the most up-to-date knowledge. And I think that you can use the powers of being new at something to create change. You're not just the student, you're actually bringing something to this organisation, so they're actually getting something off you while you're also getting something off them. So while the main point of clinical placement is for your learning, they're also using your skills and abilities and changing the way that they deliver service as well. So I think one of the greatest things is going in there with the right mentality.